Hello, I'm Umair Khalid. I'm one of the social media editors at JACC Cardiovascular Interventions, and it's my great pleasure to welcome Dr. Bharat for this interview. Thank you so much for joining us today, sir.
Thank you for the invitation.
Yeah, of course. Today, you're very happy to feature your publication titled Long-Term Outcomes of Patients Requiring Pacemaker Implantation After Transcatheter Aortic Valve Replacement, the Swiss TAVI Registry. So, Dr. Bharat, could you please begin by talking briefly about the Swiss TAVI Registry and how you design your study in this analysis, in this registry?
Thank you. So in Switzerland, the Swiss Federal Office of Public Health mandates TAVI centers performing TAVI to enroll all patients into a nationwide database. The database has a central event committee and has long-term follow-up. So we took advantage of this large nationwide database and we looked at patients that received a pacemaker within 30 days after TAVI and assessed the outcome of these patients at 1 year, 5 years, and 10 years of follow-up.
Perfect. Thank you so much for your response. Now, could you then briefly summarize the key findings of your study?
So patients receiving a pacemaker within 30 days after TAVI had a higher all-cause mortality and cardiovascular mortality at 1 year. These findings were mirrored when we adjusted for age, sex, several risk factors, or type of TAVI, and these findings were also mirrored at 5 and 10 years. Very interestingly, patients receiving a pacemaker therapy after TAVI had significantly more often a decline in left ventricular ejection fraction and more often heart failure symptoms during follow-up.
Excellent. Thank you for sharing your results, Dr. Bharat. And then one follow-up question would be, now we have so many years of data showing that pacemaker after TAVR, those patients tend to do poorly in multiple studies. And I was thinking if that's, in your opinion, is that just a risk marker or is it actually a true risk factor of causation?
This is a very, very good question. I mean, still it's observational data, so it remains subject for residual confounding. We can't claim causality at this point in time. I think it just highlights two things. One, that we need better risk stratification tools. We should avoid prophylactic pacemaker implantation TAVI patients at all costs. And B, we need more study assessing more physiological pacing methods such as conduction system pacing in the TAVI population.
Excellent. That makes a lot of sense. And still, I think this paper has a lot of meaningful input because now we know even at long term, up to 10 years, the poor adverse outcomes after pacemakers persist. So thank you so much for sharing your results, Dr. Bharat, and congratulations again on your work.
Thank you so much.